In a world where war meant not just death, but agonizing neglect for the wounded, one man challenged centuries-old dogmas. He transformed the very logic of saving lives, becoming the father of battlefield emergency medicine, a man whose name is almost forgotten today. Yet his ideas continue to save lives in every corner of the planet where an ambulance siren sounds. The history of progress, however, is not a flash of genius. It's a slow, arduous struggle against ignorance, the perseverance of one individual against a world unwilling to change. To understand the magnitude of his feat, one must envision the world from which he emerged. Picture a battlefield, not the roar of cannons, nor the cries of attack, but what followed. Thousands of bodies. The wounded, abandoned to their fate. Their pain was invisible to the general's strategies. Their destiny was death from blood loss, shock, or infection, arriving as inevitably as dawn. No one rushed to their aid. No organized evacuation system existed. Death was part of the landscape, and survival was pure chance. The wounded were simply left to die where they fell, or, at best, put out of their misery. This was not an act of cruelty, but an admission of helplessness, a complete absence of hope. What did medicine offer then? Medieval practices cloaked in a pseudoscientific mantle. Physicians, if they could even be called that, relied on the works of ancient authorities, Galen, Hippocrates, Avicenna, without questioning their dogmas. Centuries of wisdom, in their view, needed no verification. Bloodletting was considered a panacea for all ailments, from fever to melancholy. Trepanation of the skull was a common procedure to expel evil spirits or harmful humors. Hygiene? The very word would have sounded alien. Surgeons worked in soiled gowns, covered in blood and pus, a sign, they believed, of their experience. Instruments were passed from patient to patient without any disinfection. Any understanding of the connection between filth and disease, between infection and death, was utterly absent. Contamination was not a problem, but an inevitable reality that no one attempted to comprehend or prevent. Wounds were cauterized with hot irons or doused with boiling oil in an attempt to stop bleeding and cleanse damaged tissues. It was excruciating. It only hastened agony. Pus flowing from suppurating wounds was called laudable, a sign, they believed, that the body was supposedly ridding itself of the ailment. In reality, it was a death sentence, a sentence to sepsis, gangrene, inevitable death. Autopsies were rarely performed. Anatomy remained a closely guarded secret. Experience was not accumulated. Knowledge was not passed on. In this world, where pain was the norm and death the only outcome for most of the wounded, where every physician was a hostage to centuries of errors and dogmas, a man would emerge who dared to challenge the very nature of suffering and change the course of history. His name was Dominique Jean Larrey. Born in 1766 in the small village of Beaudéant, nestled in the Pyrenees Mountains, he was orphaned at a young age. He was raised by his uncle, an experienced surgeon who became his first teacher. It was his uncle who instilled in young Dominique not just the craft, but also a deep compassion for human suffering, a rarity in that era. At 21, Larrey arrived in Paris, the capital then considered the center of medical knowledge. He enrolled in the famous Hôtel Dieu hospital to continue his studies. But what he witnessed there defied every textbook. There were no grand theories, only the daily, relentless reality. Thousands of patients, overcrowding, filth, and the stench of pus and death hanging in the air. The hospital was not a place of healing, but rather a final refuge. Patients lay 2 or 3 to a single bed, with the dying alongside those still clinging to life. Wounds were not dressed promptly, and instruments were not cleaned. Physicians, adhering to centuries of tradition, merely observed the slow decline, powerless or indifferent to the outcome. They applied bloodletting, which only weakened the patients. They cauterized wounds, inflicting unbearable pain. They awaited laudable pus, which was merely a harbinger of sepsis. Young Larrey, having witnessed his uncle's work, could not accept this state of affairs. He saw not just patients, but people whose lives were fading due to inaction, dogmas, and the lack of even basic care. He observed how simple fractures turned into gangrene, how minor wounds became fatal. He realized that official medicine did not save lives, but merely confirmed the inevitable. This daily unfolding scene became a catalyst. It sowed deep doubt in him about the very foundation of what he had been taught. He began to ask questions, not just how to treat, but why can't we save? These questions, simple and obvious to us today, were heresy then. They were a challenge to an entire world built on authority and despair. His questions could not go unanswered. Larrey understood the truth lay not within the walls of Parisian hospitals, but where pain and death reached their zenith, on the battlefields. In 1792, as revolutionary France prepared for war, he made his choice. He enlisted in the army as a surgeon. This was no desk job, but the front lines, a place where every day was a test of resilience, where theory shattered against reality. There, amidst the chaos and blood, he saw it in its terrifying entirety, a system that was not merely ineffective, but lethal. The wounded were left on the battlefield for hours, sometimes days. They were transported to hospitals many kilometers from the front lines in ordinary carts, rattling over bumps. By the time they arrived, many were already dead. Those who survived suffered from gangrene, shock, and unbearable pain. Amputations were performed only 24, sometimes even 48 hours after injury. This was a death sentence. 90% of such operations resulted in death. Larrey could not accept this passivity. He observed, he analyzed. He saw that time was the wounded's greatest enemy. Every minute of delay decreased the chances of survival. He recalled how his uncle, a simple surgeon from the Pyrenees, acted quickly, without waiting for the wound to mature. It was an epiphany. If time created the problem, then speed was the solution. The beginning of his breakthrough was dictated not by a stroke of genius, but by urgent necessity. During the Flanders campaign in 1793, the French army encountered fierce Austrian resistance. The wounded were numerous, but ordinary army wagons, designed for supplies, were too slow. They couldn't keep pace with the rapid advance. Larrey stood before a pile of bodies, understanding that every hour meant dozens of lost lives. He saw soldiers bleeding out, their bodies racked with shock, and the approaching night promising cold and death. Then he made a decision, one that would have seemed insane to any military commander of that era. He approached the artillerymen, proposing they use their light, maneuverable wagons, designed for transporting cannons, but re-equip them for the wounded. Artillery wagons were fast. They could move with the troops. They could deliver aid to the line of fire. This was the first step, the creation of a mobile transport system that could evacuate the wounded immediately. He called them flying ambulances. These ambulances didn't just transport, they were equipped with a minimal set of instruments, allowing for first aid to be rendered directly at the site of injury. For the first time in history, the wounded were not left to wait. They were actively sought out. They were saved. The result was astounding. Mortality from wounds sharply decreased. Soldiers who were previously left to die now had a chance. Larrey didn't just transport the wounded, he changed the very logic of battle, incorporating rescue into the active phase of combat. This was not an act of mercy, but a strategic decision that saved lives and preserved the Army's fighting capability. But Larrey didn't stop there. He was an empiricist, a practical scientist. His method was based on 3 pillars: observation, experimentation, and immediate action. He didn't trust ancient texts, he trusted what he saw with his own eyes. If bloodletting weakened patients, he stopped using it. If cauterization hastened death, he sought other ways to stop bleeding. He was the first to insist on immediate amputation of limbs damaged by shrapnel or bullets. At the time, this was unheard of. The custom was to wait. But Larrey saw that if an amputation was performed within the first 6 hours after injury, before the onset of shock and infection, the chances of survival dramatically increased. He performed these procedures directly on the battlefield, under fire, using his flying ambulances as mobile operating theaters. His instruments were simple, but sterility, as much as was possible in that era, became his obsession. He demanded that surgical knives be sharp and bandages clean. Larrey didn't just act, he documented. Every case, every wound, every intervention. He collected data, analyzed it, and identified patterns. His works, written in French rather than Latin, were accessible to a wide range of physicians. This was an act of intellectual revolution. He shared his knowledge without concealing it behind a veil of academic esotericism. He himself invented and improved surgical instruments, making them more effective for rapid battlefield operations. He learned from every mistake, every unsuccessful case. If a patient died, Larrey didn't just record the fact, he tried to understand why. He performed autopsies, examining internal injuries, trying to connect them with external manifestations and treatment methods. This was a truly scientific approach in a world dominated by dogma. His compassion, instilled by his uncle, was now bolstered by rigorous logic and a thirst for knowledge. He didn't just save lives, he built the foundation for all modern emergency medicine, step by step, overturning centuries-old misconceptions. However, such a breakthrough, such audacity in challenging centuries-old customs, could not go unanswered. The medical world, entrenched in its dogmas, saw Larrey not as a savior, but as a subverter. His flying ambulances, his demand for immediate operations directly on the battlefield, his rejection of bloodletting and cauterization, all of this was perceived as a direct assault on sacred traditions. Old professors from Parisian hospitals, respected physicians whose names were enshrined in textbooks, openly expressed their outrage. They called his methods barbaric. They accused him of recklessness. They claimed that amputations performed so quickly killed patients rather than saving them. In their view, Larrey violated unwritten rules. He didn't wait for laudable pus. He didn't follow Galen's prescriptions. He acted based on his own observations, not on the authority of the ancients. This was unthinkable. His fellow surgeons, accustomed to unhurried procedures in the rear, to waiting for wounds to mature, viewed Larrey with distrust, and at times, open hostility. They wrote complaints. They demanded his removal from practice. They argued that his innovations merely brought chaos to the established order. The military command also initially resisted. The idea that lightly armored artillery wagons intended for cannons would be used for the wounded seemed absurd. Generals saw it as a diversion of resources, a disruption of logistics. They didn't understand how medical aid could be part of active combat operations. The death of the wounded had always been a part of war. Why should that suddenly change? "We are fighting a war, not practicing medicine," they said. "Soldiers should die on the battlefield, not divert valuable resources." Larrey faced a brick wall of misunderstanding and conservatism. His ideas were called heresy. He himself was labeled an upstart. Attempts to ban his work were constant. He was ordered to dismantle his mobile hospitals, to abandon immediate amputations, to return to traditions that, in the opinion of the majority, were the only correct ones. But Dominique Larrey had one powerful argument: results. Mortality among his patients was significantly lower. The soldiers he saved returned to duty. It was these results that captured the attention of those at the pinnacle of power. His chief patron became Napoleon Bonaparte himself. The emperor, a pragmatic and far-sighted man, quickly grasped the military significance of Larrey's approach. He saw not just mercy, but an effective means of preserving the army's fighting capability. Healthy, saved soldiers were not just lives, they were fighting units who could take up arms again. Napoleon personally observed Larrey's work on the battlefield on multiple occasions. He was a witness to his incredible speed, his composure under fire, and, most importantly, his success. The emperor not only protected Larrey from the attacks of the old establishment, but also promoted him through the ranks. Napoleon granted him the title of Baron, awarded him with honors, and provided him with necessary resources. The support of such a man gave Larrey unprecedented freedom of action, allowing him not only to continue his experiments, but also to implement them across the entire army. Napoleon saw Larrey not merely as a surgeon, but as one of his most valuable generals, capable of saving lives where others could only confirm death. Thanks to this powerful backing, Larrey's ideas, despite fierce resistance, began to make headway, changing the face of military medicine forever. Napoleon's support was more than just a shield. It transformed Larrey into the architect of a new era. In 1805, on the eve of the Austerlitz campaign, the emperor granted Larrey unprecedented authority, appointing him chief surgeon of the Imperial Guard. This was not just a high title, it was an absolute mandate for reform. Larrey gained the right to dictate, the right to demand. The right to change centuries-old customs. His word became law for all surgeons of the Grand Army. He could dismiss anyone who did not follow his principles. His orders reached the most remote hospitals. He personally inspected field stations. He conducted demonstrative surgeries. He trained young doctors, turning them into his followers. The scale of his triumph became evident during Napoleon's bloodiest campaigns. In Spain, on the fields of Borodino, at Waterloo, wherever cannons roared and blood flowed, Larrey's system worked. At Borodino in 1812, during one of history's most brutal battles, his flying ambulances evacuated thousands of wounded directly from under fire. It was a spectacle, light wagons rushing through smoke and chaos, snatching soldiers from the embrace of death. Immediate amputation, performed within the first 6 hours after injury, became more than just a recommendation. It was a mandatory directive. Larrey proved its effectiveness by personal example, performing up to 200 amputations a day, working without pause. His instruments, though simple, were always sharp. He insisted on the highest possible cleanliness. He completely abandoned bloodletting and prohibited cauterization with hot irons or boiling oil. Instead, he advocated for meticulous ligation of vessels and application of clean dressings. These simple but radical measures saved thousands of limbs from gangrene and thousands of lives from sepsis. The results spoke for themselves. If previously 90% of severely wounded soldiers, especially those with extensive limb injuries, were doomed, now, thanks to immediate intervention, more than half survived. This was an astonishing figure. These were not just saved lives, these were soldiers who, after recovery, could return to duty. The Army maintained its fighting capability. Flying ambulances became an integral part of every Army corps. Their crews, consisting of trained surgeons and stretcher bearers, operated according to a clear protocol. A triage system was developed, sorting the wounded by severity and urgency of care, with priority given to those who could be saved immediately. This concept today forms the basis of all emergency medicine, from sorting casualties at a disaster site to a hospital emergency room. His works, such as Memoirs of Military Surgery and Campaigns, became essential texts for physicians worldwide. He didn't just create a method, he created a system that worked. He laid the foundation for all modern traumatology, for emergency medical services, for the principles of rapid response to emergencies. He proved that even amidst the total chaos and brutality of war, it was possible and necessary to fight for every life. His legacy is not only Napoleon's saved soldiers, it is the millions of lives saved every day. In every corner of the planet where an ambulance siren sounds, where a doctor fights for a patient on the brink of life and death, the shadow of Dominique Jean Larrey is invisibly present, the man who dared to challenge despair and give the world hope for salvation. The shadow of Dominique Jean Larrey is indeed invisibly present in every moment when a life hangs in the balance. His legacy is not bronze monuments or textbook pages remembered only by specialists. It is the very logic of salvation forged in the fires of war, but becoming a universal law of peace. The paradox of his greatness is that a military surgeon, operating amidst chaos and brutality, laid the foundations for all modern emergency medicine, from civilian ambulance services to intensive care units. He proved that speed, observation, and immediate intervention can turn the tide of even the most hopeless situation. His perseverance in fighting centuries-old misconceptions, his refusal to blindly follow authorities in favor of lived experience, his readiness to act when others merely waited, all of this became more than just a method. It became a philosophy that transformed humanity's relationship with pain and death. Larrey's story is not about a brilliant discovery, but a narrative of relentless struggle for each individual life, which ultimately transformed entire systems. It is a lesson that true progress is born not from convenient dogmas, but from the audacity to challenge despair, from the courage to see reality as it is, and from the deep compassion that drives science forward. And in this invisible yet pervasive shadow lives the eternal echo of his achievement.